Okay, so we're now live on YouTube, and I will close that, and I will begin recording in one moment so that we can also share this. We've got about 75 people on the line right now, and I will welcome everyone to please let us know what part of the province you're looking in from using the chat function in your Zoom toolbar. And that's where we'll be asking you to share your questions for our guest once we are in that part of the conversation where we're soliciting your questions. And unfortunately, we're not able to answer your personal health questions. That's best left to you and your healthcare provider, who knows you better than we do over the internet. But we're looking for your questions on the topics that we're covering today, specific to influenza, COVID, and vaccines for older adults. And I'm seeing the clock is just about reaching the top of the hour, so I'm going to start recording this now. And as we're just at the top of the hour, I will start by welcoming everyone and introducing myself. I'm Anthony Quinn. I'm the Chief Community Officer at CARP, also known as the Canadian Association of Retired Persons. And this is part of an ongoing series of webinars where we hope to inform and educate CARP members across Canada through a series of educational events that focus on topics that are important to our members. Webinars have proved invaluable during this time of pandemic, and we've been able to continue meeting with and communicating with our chapters who aren't able and haven't been able to host meetings and events in their local communities, and the webinar has proven to be a great way for our audience to continue to engage. And I'm pleased to be joined by Cherlyn Cortes-Manderson. She is an RN in East Van and working in public health, and has agreed to join us today on our topic of conversation, which is the most up-to-date information for CARP members in relation to influenza, vaccinations, and outbreaks, COVID-19, and everything else related to adult immunization. So welcome, Cherlyn.
Thank you so much, Anthony. I'm so glad that you are on the call, Anthony, because I've never live streamed anything before. I would not know how to do that. So thank you.
Well, you're the expert, and I'm the technical director today. You're our health expert, so we're very glad to have your expertise with us this afternoon. And
thank you.
if you are able to share your screen, I understand you have some slides, but the goal of today's meeting is to hear from you and then solicit the questions from our members and hopefully answer any questions or concerns they have about this topic.
Okay, great. So let me go ahead and try and share here. And so you can see a slide, is that correct? But you don't see any of my notes or any of the answers to the quizzes that will be coming up?
That's right. We just see your influenza update and vaccines homepage, and both of us are on the screen as well.
Okay, and so I was just joking, there will be no quizzes.
No,
so don't worry.
I was ready for more interactivity.
Okay, so thank you, everyone. Good afternoon, and maayong hapon in the dialects of both my parents, who are originally from the Philippines. And again, I want to say thank you to Bill and Anthony and the great team at CARP who have organized this today. And my thanks to all of you, all of the attendees, for joining me during this very busy holiday season and taking the time for us to all be together. My name is Cherlyn Cortes-Manderson, and my pronouns are she and her. And I worked as a frontline RN and clinical nurse educator for the past 18 years. Over these years, I've been fortunate to work in many areas, including immunizations, public health, harm reduction, and primary care. And recently, during the height of the pandemic, I was working frontline at a primary care clinic and also as a public health resource nurse with the immunization team at the BC Centre for Disease Control. And currently, I'm a nurse educator with the harm reduction and sexual health teams at the BC Centre for Disease Control. So I want to start by honoring the Musqueam, Squamish, and Tsleil-Waututh nations on whose unceded and traditional lands I'm calling from today. These are lands that are also known as Vancouver, BC, and I'd like to ground my acknowledgement through this picture of a deeply meaningful place. It's a place where we often take our Australian cattle dog, Monkey, who is perched on a log on the shores of Tsleil-Waututh, which is the Hunkaminam name for Burrard Inlet. And I'd like to express my gratitude to these nations for stewarding and nurturing these lands that I'm very fortunate to live and work on. So my disclosures are that I'm receiving an honorarium for this presentation today, but the guiding principles for this presentation are those of best evidence, and any recommendations that will be presented are in accordance with national advisory bodies that provide evidence-based recommendations on the use of vaccines. So today I will be doing an update on influenza. It's probably high time. We've been so focused on very other important respiratory illnesses, as we should be, but it's also time once again to start focusing on influenza. And so I will be talking about the many reasons that our best protection against these respiratory illnesses is vaccination. So I will be doing an overview of the influenza vaccines that are available, particularly geared towards older adults, some new vaccine options. We'll be talking a little bit about vaccines that are publicly funded, so those that are offered free through public health, and those that you can pay for out of pocket. And so I will be focusing more on influenza in this presentation, but I will touch on COVID-19 fall boosters and pneumococcal vaccines. So just as a bit of a kind of recap, influenza is a contagious respiratory illness caused by influenza viruses that infect the nose, throat, and lungs. And some people, such as those 65 years of age and older, young children, and people with certain health conditions, are at higher risk of serious flu complications. There's also two main types of influenza viruses. There's type A and type B. Influenza A viruses, these are the ones most associated with causing epidemics and pandemics, while influenza B generally causes more mild epidemics. So as a nurse, one question that I've been getting a lot lately these past couple of months, especially from friends and family who are having respiratory symptoms, they all want to know, do you think it's the flu or do you think it's COVID? So in the words of Danuta Skowronski, who is the lead for influenza and emerging respiratory pathogens at BCCDC, who said, if you're not sure whether or not you've ever had influenza in the first place, then you haven't. And that's because influenza typically comes on fast and can really hit a person hard, which is what I experienced this fall when I myself unfortunately got the flu. And this was before the influenza vaccines were available. Unlike when I got COVID for the first time this past summer, I wasn't sure if it was COVID or not. And I didn't really know until I got a positive test. But when I got the flu, for me, there was no mistaking it. I knew. And this is a graphic showing that there are definitely some similarities between the symptoms that you can get with the flu and the symptoms that you can get with COVID. And really, the symptoms can often be so similar that it can still be really hard to tell. But where you can tell the difference is when you compare these viruses with the symptoms you get from the common cold. The common cold is really a much milder illness, usually very brief, and typically symptoms are runny nose, sore throat, sometimes sneezing, but you don't get the muscle aches or the headaches or the fatigue and exhaustion that you do with COVID or the flu. So I can't stress this enough. In order to prevent getting the flu, we have to use all the tools at our disposal. And that still includes getting vaccinated, washing our hands frequently, and wearing masks more often. Influenza is highly contagious, and transmission occurs mainly by droplets made when someone with the flu coughs or sneezes. These droplets can spread up to 6 feet away. In addition, the influenza virus can survive on surfaces for 24 to 48 hours. And older adults can be at increased risk of exposure due to close living quarters and also sometimes having shared caregivers in long-term care. So there is no doubt that COVID-19 changed our lives in many different ways. And this includes changes in the epidemiological trends of influenza. In other words, the COVID-19 pandemic has affected the how, the where, and the when influenza is occurring in different groups of people across the globe. And so I do want to start by talking about that we were able to see the impact of these changes during this past summer, and in particular, when we saw how the influenza season unfolded in Australia. And that's because when forecasters try to get a read on what influenza might have in store for North America in any given winter, they look to countries like Australia and New Zealand, where the season typically runs from April to October, because these are the winter months in the Southern Hemisphere. And unfortunately, when we looked to Australia 6 months ago, things were not looking good. And to quote an article from CNN, this year Australia had its worst flu season in 5 years. So typically in Australia, they usually see the peak of their influenza cases happening in August and September. And on this graph, you can see that this is where this gold square is highlighting. But this year, numbers started to pick up in mid-March and then peaked 3 months earlier than normal in May and June. So just like with COVID, where we have different variants, the influenza virus has different strains. And in Australia, we saw that the strain called influenza A was the main culprit. Unfortunately, this is the one that's also associated with more severe illness, particularly in elderly individuals and those with compromised immune systems. But the good news is that the data from Australia shows, as well as data from the US Center for Disease Controls, that the influenza season vaccines this year are a good match to protect against the currently circulating flu viruses. And that's why in this slide, we can see that in Australia, after they launched their influenza vaccination campaign, they saw a significant drop in their influenza cases. And you can see the drop happening on this slide right after the green markings that show when they started their influenza vaccination campaigns. But one big question is why? Why did Australia's influenza cases peak about 3 times higher than the average for that period, and then top out 2 months earlier than they normally do? Well, one of the reasons is that we had historically low number of flu cases in the past 2 years, which is often attributed to the implementation of preventative measures against COVID, such as masking and practicing social distancing. Immunity to respiratory viruses, including the flu, also does wane over time. So this waning in our immunity, combined with our lack of exposure to the flu in recent years, and the fact that we are masking less, and that we're traveling more and gathering more, means that we are more susceptible. And young children in particular may be most at risk because their immune systems have had even less exposure to the virus. In Canada, pediatric hospitalizations for seasonal influenza have climbed, and at present they are more than 10 times the normal rate for this time of year. In late November, weekly admissions were 50% higher than at the record peak for at least the past 7 flu seasons. This graph shows the gray peaks as being more typical of pediatric hospitalizations for severe flu in late November of pre-COVID seasons. And then the flatter blue line represents these hospitalizations last year when we saw less circulating influenza impacted by public health measures. But here we see the orange line showing pediatric hospitalizations just this past November as 20 times higher than usual. And unfortunately, we are now seeing that surveillance levels indicate that the hospitalization rate of seniors due to influenza is not that far behind that of children. Media reports from this month alone point to a sharp increase in the rate at which people 65 years of age and older are hospitalized from the flu. Infectious disease specialists state that in most years, children tend to get the flu first and then bring it home to their parents and grandparents, and that hospitals are now on the cusp of seeing that impact. And it's this very important role that many older adults have in our families and our communities of being the caregivers of young children, and in many instances providing the much needed daycare and after school care that can also at times put them at increased risk of getting the flu. In addition, there are many chronic conditions that can also increase the risk of getting the flu. And around half of Canadians aged 50 to 64 reported having at least one of these conditions. And this includes having an elevated BMI, diabetes, asthma, COPD, heart disease, cancer, or stroke. Here's an image that shows the potential negative impacts that hospitalization can have on our loved ones who are 65 years and older. Between 30 and 60% of older patients experience a functional decline after hospitalization, resulting in a decline in health-related quality of life and independence. And this is also associated with increased risk of readmission, nursing home placement, and mortality. So annually in Canada, it's estimated that influenza causes approximately 12,200 hospitalizations and 3,500 deaths. And again, this is a little bit of older data over the past several years. But as the image on this slide shows, that's only the tip of the iceberg. Influenza can be a part of a cascade of other negative health outcomes, potentially leading to impacts beyond the lungs. For example, studies have shown that the risk of stroke or heart attack increases shortly after a flu infection. These are two major health episodes that can lead to a further loss of autonomy for that individual. Influenza can also lead to a worsening of chronic illnesses due to the fact that influenza, once it enters our lungs, can actually lead to an inflammatory cascade. And what this means is that once the body recognizes that it's been infected with the flu, it starts to recruit numerous immune and inflammatory cells to help fight off that infection. But when someone is already living with a health condition or a chronic illness, this process can start to overwhelm other organs, leading to dysfunction of these organs and other health complications. And the most obvious complications are associated with the respiratory system, such as secondary infections like bronchitis, pneumonia, sinus infections, and ear infections. It's also well recognized that influenza can worsen a number of underlying chronic conditions of the respiratory system, including asthma and COPD. But I think what is less widely known are the effects that an influenza infection can have to other organs and body systems. Influenza infection has been shown to increase the risk of heart failure, inflammation to the lining of the heart and muscle. And in a UK study, they found that older adults with cardiovascular disease had an 8-time increased risk to have a stroke in the 3 days after having lab-confirmed influenza infection. Influenza can impact the body's ability to control blood glucose levels. And for those with existing kidney disorders, diabetes, and influenza infection put these people 3 to 6 times more at risk to be hospitalized. And in this study performed in Ontario, they looked at health data from people aged over 35 and older who had a laboratory-confirmed influenza. They looked at their health data for the year before their influenza case and then again 1 year later. And what they found was that these individuals had a 6-fold higher incidence of having a heart attack in the week after their influenza infection as compared to the year before and after. An increased risk of a heart attack was seen even in those who did not have a previous history of a heart attack. And the researchers also found that this risk of a heart attack after the flu was increased even more for people 65 years of age and older. And interestingly, this elevated risk was present in both cases from influenza A and influenza B, which highlights the need for protection from both types of influenza. So we know that the flu on its own is serious, but it can also have serious impacts to a person's health beyond just having the flu. But thankfully, in Canada, we have several great options for influenza vaccines, which once again, in the words of Health Canada, getting vaccinated against influenza each fall is the best way to help prevent infection. And this is why it is important that you seriously consider getting both your flu vaccine and your COVID fall boosters, if you haven't already, and to not delay, get them as soon as possible, especially as we head into our first BC winter holiday season without restrictions since the pandemic began. And you can get these vaccines at the same time. Studies conducted throughout the COVID-19 pandemic indicate that it is safe to get both a flu vaccine and a COVID-19 vaccine at the same time. And this is exactly what I did once they were available this fall. And the reason that it's so beneficial for you to be vaccinated against both viruses is because they are different viruses that require their own specific vaccines. Let's take a look at this image of the SARS-CoV-2 virus. Now, most of us are aware that the SARS-CoV-2 virus is the virus that causes COVID, and it has a surface that is covered in spike proteins. It's these spike proteins that act as antigens in our body. In our bodies, an antigen is any substance that can trigger an immune response. And this is why vaccines contain antigens. They are the key ingredient. So now let's take a look at the influenza virus. You'll notice that these two viruses are different. They look different and their structures are different. This influenza A virus does not have spike proteins. It has different proteins with very long names like hemagglutinin and neuraminidase. So even though these two viruses may cause very similar symptoms in people, they are not the same and they require different vaccines. The virus that causes COVID has spike proteins and needs a vaccine with that antigen. The influenza virus has hemagglutinin and neuraminidase proteins, and so needs a vaccine with these antigens. Health Canada has authorized 2 bivalent Omicron-containing mRNA COVID-19 vaccines, the Moderna Spikevax bivalent vaccine and the Pfizer bivalent vaccine. The original COVID-19 vaccines target one strain of the COVID-19 virus, and this is the original SARS-CoV-2 virus from 2019. Bivalent COVID-19 vaccines target 2 strains of the COVID-19 virus, the original strain and the Omicron strain. And the virus that causes COVID-19 has evolved over time, and some of these changes have created new variants of concern. These bivalent vaccines have been updated to provide better protection against these variants. And in BC, it's recommended that everyone aged 5 and up receive a fall booster dose, at least 6 months after your last dose, or 3 to 6 months after the onset of COVID symptoms or a positive COVID test. And so when it comes to the influenza vaccine, we have a few different options, and even one new option. And that's because there's always work being put into vaccine technology to improve it and to ensure the high degree of safety that we have with approved vaccines. And part of why we have really good safety with these vaccines is because of how they're made. And so this is some very excellent information taken from Dr. Paul Offit at the Children's Hospital of Philadelphia. I'm going to do a plug here. I don't know Paul Offit, never met him, but I watch lots of his YouTube videos, which are excellent. So Paul Offit YouTube, or if you just want to Google CHOP, EDU, excellent vaccine information. So for example, these vaccines we use to target viruses, also known as viral vaccines, can be made in the following ways. So one way is that you can take a whole virus and then weaken it in the laboratory so that it can still reproduce in people, but much, much less so than normal. Or a natural virus. So you can use an immune response, you can cause an immune response without having to suffer the disease. Or you can grow a whole virus and purify it and then disable it, which is, in other words, killing it, inactivating it with a chemical. And in general, this is traditionally how most of our influenza vaccines have been made, either by weakening the virus or inactivating the virus. But what is new on the market is a flu vaccine that is manufactured using only a piece of the virus. And that's the vaccine known as a recombinant influenza vaccine. This new vaccine only contains one protein from the influenza virus, the hemagglutinin protein. And because it only contains a protein, it cannot cause influenza after vaccination. And yet another way that viral vaccines can be made is by using a part of the genetic code of the virus. And this technology is not used to make influenza vaccines, but it is how our COVID mRNA vaccines are made. So instead of triggering an immune response by putting a weakened or inactivated virus into our bodies, the mRNA vaccines use mRNA. And mRNA is created in a lab to teach our cells how to make a protein, or even just a piece of a protein that triggers an immune response inside our bodies. The mRNA in vaccines, in a sense, tricks our bodies, and it tricks the cells into creating parts of the virus that can trigger the immune system response. So to use a holiday baking analogy, because it is the holidays, an mRNA vaccine is kind of like when my niece was visiting last winter, and I said, hey, let's make cupcakes. And they were so excited. I pulled out all the bakeware for them and the ingredients, and then pulled out the recipe and said, okay, you make them. And they did. And they made and iced them all. And it was great for me because I ate so many cupcakes. But that's kind of, in a sense, what an mRNA vaccine does. It provides the instructions to your cells so that then it can do the work of creating this immune response. And when it comes to the influenza vaccine in BC, we have 4 different kinds that are available. We have what is called the standard dose vaccines. And this is the vaccine that is available for free to everyone in BC, because it's publicly funded. and it is so to everyone 6 months of age and older. It's a quadrivalent vaccine, meaning that it protects against 4 strains of the influenza virus. And these are the same 4 strains that the World Health Organization recommends that a quadrivalent vaccine should have in order to protect against the flu. Another free vaccine that we have in BC, but this time it's only for those 65 years of age and older, is the adjuvanted vaccine. This vaccine protects against 3 strains as opposed to 4. However, it still protects against the 3 main circulating influenza strains. It has the same amount of antigen as the standard dose vaccine. And this vaccine is called adjuvanted because it contains MF59, which is an ingredient that helps create a stronger immune response to vaccination. Another really good option for those 65 years of age and older is the high-dose influenza vaccine. Like the standard dose, it protects against 4 influenza strains, but is 24% more effective in preventing lab-confirmed influenza compared to the standard dose vaccine. And this is due in part because it actually has 4 times the amount of antigen, helping to make it a highly effective vaccine for older adults. Remember that the antigen is the key ingredient in a vaccine, and it's the trigger that makes our bodies create an immune response, which later gives us the protection we need if we come into contact with the virus in real life. To use another holiday baking analogy, the more cookie batter you have, the more cookies you'll get. So the idea is with more antigen to work with at the outset, you'll get a more robust and stronger immune response. However, this vaccine is not publicly funded for everyone over the age of 65 in BC. While the high-dose vaccine is available for purchase at your local pharmacy, it is only provided free to individuals 65 years of age and older in BC who are residents of long-term care, assisted living facilities, and First Nations communities. And the other type of influenza vaccine, as I mentioned, is the recombinant influenza vaccine. And so far, it's the only vaccine of this type that is licensed in Canada. It also protects against 4 strains of influenza, so it is quadrivalent. And in adults 50 years and older, it was found to provide better protection compared to the standard dose vaccine in a study of the 2014-2015 influenza season. It found that the probability of lab-confirmed influenza illness was 30% lower with recombinant influenza vaccine. And again, like the high-dose vaccine, it has a high antigen content. This vaccine's effectiveness comes from its content of 3 times the standard antigen dose. In addition, the recombinant vaccine is made using just a piece of the virus, again, the viral protein that I mentioned called hemagglutinin, so it cannot cause influenza after vaccination. But because it contains an identical hemagglutinin protein to the one that's actually in the virus, this vaccine can be made ensuring a perfect match to the influenza strains recommended each year by the World Health Organization. And this is important because it is one of the challenges we face every year with each new influenza vaccine. Sometimes we are not able to get a perfect match to the strains that are actually circulating out there. And part of the reason is that unlike the recombinant vaccine, most influenza vaccines are made first growing the virus in chicken eggs. But this can sometimes lead to mutations because, unsurprisingly, there are differences in human cells and chicken cells, and in particular, the cells that the virus needs to recognize and latch onto. But what I want to focus on are 2 of these vaccine types in particular, because these are the ones that are particularly recommended for those age 65 and older. And that's the adjuvanted vaccine and the high-dose vaccine. And so one reason that these vaccines are especially recommended for people 65 years of age and older has to do with a thing called immunosenescence. So this slide kind of spoke to me, and so I decided to include it because it says I'm almost 40, but I still feel like I'm 20 until I hang out with 20-year-olds. And I'm like, no, never mind, I'm 40. Well, I'll tell everyone today, I am definitely past the age of 40. I won't say exactly how past, but I am definitely past. And I can tell you, I don't ever feel like I'm 20. So earlier when I mentioned that I had had COVID and influenza this past year, one thing that I want to share is that even after my symptoms subsided, say after that initial first week, I was still felt very sick for 3 weeks after my symptoms started. So again, my original symptoms, they were different from each other. COVID was different than when I had the flu. The flu, I felt it was much harder. But both infections left me with ongoing fatigue, persistent congestion. My ears were constantly plugged. I really couldn't hear anything for 3 weeks after. And it was almost like to the day 21 is when things started to finally turn around. And that is because of immunosenescence. And immunosenescence happens because the quality and the number of immune cells that we have starts to change as we get older. We don't react as well to antigens like we used to when we were younger. And so this affects how well a vaccine can work after we receive one. And it means then that because of that, we can be more susceptible to infections and the development of age-related diseases. And in fact, the thymus gland, which is a small gland in our lymphatic system that makes and trains some of our most important white blood cells, this gland actually starts to shrink and change as we get older. And this process is actually usually complete by the time we hit the age of 40. And so this need to have access to influenza vaccines that can help older adults mount a more effective immune response is why a few months ago, the BC government announced that in addition to continuing to offer everyone 6 months and older an influenza vaccine for free, this year the province is offering all seniors 65 and older an enhanced influenza vaccine. Now, there weren't specific details given about the vaccines with these early announcements, but what has since been repeated in the news is that for people 65 and up, there are enhanced vaccines. And so when I first heard that, I was very intrigued, and it's a very positive thing because having more options can really provide a benefit when it comes to health. When I'm talking to my own healthcare provider and I get to choose between different options regarding my own well-being, I feel empowered. And I feel good because I'm being proactive about taking care of myself and in turn, my family and my loved ones. But when it comes to enhanced, what does enhanced mean? So it kind of reminds me of when I was booking a flight for myself and for my parents recently. And it was, the first time I've done that in a couple of years. So I was, kind of excited, and I got even more excited when I saw all these new options when you can book your seat. And so I saw, okay, there's economy, but now there's also premium. And so when I saw premium, I thought, wow, I'm getting a bed, because that's what premium means to me. It means I get to stretch my legs out and drink champagne until I take a nap. And I won't need those neck pillows because I'll get a real pillow. But what I realized is that my idea of premium is not the same as another person's idea of premium. So enhanced is a very good way to differentiate that there is a difference from the standard dose formulation of flu vaccine. But it doesn't tell us more than that. So just like there is no industry standard for what defines the different airline classes like economy, premium, business, first class, there is actually no accepted definition of what enhanced means when it comes to vaccines. So when you hear or read about enhanced, again, it's being referred to the high dose and the adjuvanted vaccines. And both of these vaccines were developed with the goal of eliciting a stronger immune response for people 65 and older. And so while these two vaccines have a similar goal in mind, which is producing a stronger immune response for people 65 and up, what does the evidence show? Well, we see that the evidence about the high dose formulation and a stronger immune response for those age 65 and older shows that, as per the US Center for Disease Control, there is actually no randomized studies comparing the efficacy of high dose and adjuvanted vaccines against lab confirmed influenza. So these two types of vaccines actually have not been directly compared to each other. But a randomized study that was published in the New England Journal of Medicine did show that the high dose vaccine, as I mentioned earlier, is 24% more effective in preventing flu in adults 65 years and older when you can compare it to the standard dose vaccine. And so some of you may be familiar with NACI. So NACI is the National Advisory Committee on Immunization, and it's been Canada's advisory group since 1964, and it is the go-to resource for public health professionals because NACI develops all of the recommendations and advice on vaccines that are approved by Health Canada. And so this information is taken from Table 5 from the annual NACI statement that they produce every season for influenza. And so this comes from the most recent one for this season. And so in this table, it shows that there is an expected superior response to influenza A strains from the high-dose vaccine compared to the standard dose. And it also shows a superior response to the additional B strain compared to the standard dose. And when we look at what NACI says about the evidence for the adjuvanted vaccine in protecting older adults, it is different from what we see with high dose. Again, NACI confirms that there's been no head-to-head randomized controlled trials comparing the two, but they did look at unvaccinated individuals and found that there is only fair evidence that the adjuvanted vaccine may reduce the risk of hospitalization and complications related to influenza in those 65 and older, and that there was insufficient evidence that the adjuvanted vaccine is more effective than the standard dose at reducing these risks in the same age group. So based on the evidence that NACI has to date, NACI makes the following recommendations for making a decision about vaccines at both the individual level and at the public health program level. At the individual level, these recommendations are intended for people who want to protect themselves from influenza, or for vaccine providers wanting to advise patients and their clients about preventing influenza. And program level recommendations, these are intended for provinces and territories responsible for making decisions on which vaccines should be publicly funded. So NACI goes on to say that these two recommendations, the individual level and the program level recommendations, they sometimes might be different. And that is because there are important factors to consider when recommending a vaccine for a whole population. There's things like the demographics of the population, there's costs, economic considerations, and these are considerations that are different when we're just talking about an individual person. So at the individual level, for those 65 and up, the NACI recommendations are that high dose formulation should be used over the standard dose, given the high burden of influenza A disease. And again, we saw from the Australia data that influenza A was the main culprit. And also, NACI states that there's good evidence of high dose providing better protection compared to standard dose in those 65 and older. And at the public health program level, it states that influenza vaccine is especially recommended. So this is just any influenza vaccine. It is especially recommended for people with certain conditions like cardiac or pulmonary disorders, asthma, COPD, and also recommends that any of the influenza vaccines should be used in the public health programs because the truth is they are all safe and they are all effective. So especially if a product isn't available, you should definitely just get what is available because again, influenza is circulating. It's in our communities, in our young ones, and now in our older ones. So don't delay. If you are at a pharmacy or at a clinic and they have one that's available, just get that one because you will still get good protection. And this is because at the program level, they are thinking about what is best for the entire population, what's best for the population level and for the whole community. So this is why there is a difference in what we see being publicly funded for adults 65 and older across the country. And that's because every jurisdiction has to make the most feasible decision for them. And it's really so that they can get the most access to the most people for these vaccines. So when it comes to the high dose vaccine and publicly funded programs, we see that some are making it available for all adults 65 and older, while some are using a more targeted approach like us in BC. But the benefits of the high dose formulation are clear. Here in BC, it is being made available for adults 65 and older living in long-term care, assisted living, and First Nations communities. And this is to combat some of the increased risks of influenza that residents can face. One study found that 25% of residents experienced a decline in at least one major function, such as bathing, dressing, and mobility for at least 3 to 4 months after an influenza infection. But again, if you're 65 and older and you aren't residing in these specific locations or communities, it doesn't mean that the benefit for you is not there. It still is, which is why at the individual level, NACI does recommend the high dose over the standard dose. And I want to just mention this is a study that kind of stood out for me, and it's a study from 2014. And in this study, the authors advocate for approved but unfunded vaccines to continue to be a part of the conversation. So these are, vaccines that are approved by Health Canada, but maybe not being funded publicly by public health care. So the authors state that the funded immunization programs are best able to achieve high participation rates, optimal protection for the target population, and indirect protection of others. However, in many countries, public funding of approved vaccines can sometimes be delayed or just limited to a portion of the population, which is what we're seeing here in BC, where the high dose is only for a limited portion of the above 65 population. And in these situations, unfunded vaccines are often inaccessible to those who are still at risk, allowing potentially, some avoidable illness and mortality to still occur. So the authors of this study state that private access to approved but unfunded vaccines should be reconsidered and encouraged, and that some people will take advantage of a vaccine if they know that it's something that they can still pay for and is available to them. So here I do want to touch on pneumococcal vaccines very briefly. So Streptococcus pneumonia is a bacteria. So we've been talking a lot about viruses, but pneumonia is a bacteria, and it can spread from person to person via droplets from the nose or mouth by sneezing or coughing. It can cause many types of diseases, such as community-acquired pneumonia, and this is the pneumonias which are, mild, with fever and cough, but it can also be more severe, leading to things like respiratory distress. Streptococcus pneumonia can also cause a pneumonia called IPD. So IPD is a severe form of infection that occurs when the bacteria invades the bloodstream or the central nervous system, leading to bacteremia or meningitis. And adults 65 years of age and older are among the high-risk groups for getting pneumococcal disease. According to the American Lung Association, even healthy adults age 65 and older are over 10 times more likely to be hospitalized with pneumococcal pneumonia than those aged 18 to 49. So there are two distinct types of pneumococcal vaccine available for adults in Canada, and that's the polysaccharide pneumococcal vaccine that protects against 23 types of pneumonia, and a conjugate pneumococcal vaccine that protects against 13 types of pneumonia. So I'll probably just refer to these going forward as pneumonia 23 and pneumonia vaccine 13. So the pneumonia vaccine 23 is recommended and provided free to everyone 65 years of age and older in BC. One dose can provide up to 10 years of protection, and a booster is not usually needed, unless there is a certain health condition that puts a person at particular risk for the invasive pneumonia, such as those with organ transplant, HIV, chronic liver disease. But otherwise, most individuals will not need a booster dose with the pneumonia 23 vaccine. And but for those specific individuals, if they do require a booster dose, it's just one booster dose 5 years later. And the pneumonia 13 vaccine is normally provided free, but only to infants and children. But you may decide to pay for this vaccine if you are 65 and older, because it does help prevent pneumonia and certain types of pneumonia. In a study from the Netherlands looking at 85,000 adults who were 65 years of age and older over a 5-year period, it showed that the pneumonia 13 vaccine showed a 46% efficacy against pneumonia and 75% efficacy against the invasive pneumonia. So while the pneumonia 23 vaccine is the only one that's free if you're 65 and older, you may decide to pay for the pneumonia 13 vaccine. And if you do decide to get both, there is an order that the vaccines should be given. So the schedule, it goes like this. So if you're getting the pneumonia 13 vaccine first, then you can get the pneumonia 23 vaccine 8 weeks later. But if you have already had the pneumonia 23 vaccine, you do have to wait 1 year until you can get the pneumonia 13 vaccine. And so paying for the pneumonia 13 vaccine, I will just share, it is something that my own mom decided to do. She's in her 80s. She is a very kind of active and healthy 80s person in her 80s. But she really just wanted to have that extra protection. And one story that I'll share is my dad, who's a bit older than my mom, who does have conditions that he does require medications for, and my mom isn't. She's not on any daily medications right now. But when they both got COVID early this year, early in January. And I was really worried for my dad because he's the one who takes the medications, and he didn't have a single symptom. He was asymptomatic. And my mom is the one that got really sick. So it just goes to show that, as I stated earlier in this slide, that even healthy adults can still suffer some of these effects. You really just don't know. I mean, it's obviously very important to do your best and just try to be as healthy as possible. And sometimes that does go a long way, but sometimes we just don't know why it still kind of falls short with certain infections. And it's really just because infections can be so individual. And you hear it all the time with people who had COVID or flu, where the symptoms can still be so different from person to person. And so can the protection that we get. So that's why, it is still an important conversation that you can have. And I do encourage people to bring these conversations up with their healthcare providers or their pharmacists. I heard about this vaccine. Can you tell me more about it? I might be interested in getting this as well. And so, I do want to say, if you haven't been vaccinated yet, please do so. I think hopefully most of us are familiar with the Get Vaccinated website here. And I will probably just pause now and make some room for any questions or comments.
Well, thank you very much, Cherlyn. I've been listening with rapt attention, and I'm sure our audience has as well, and we do have questions. But tell me about registering to get vaccinated in British Columbia. I'm coming to you from Ontario.
Oh, sorry,
and,
yes.
And is getting vaccinated, is it required to register, or can you just show up with your provincial health card at a pharmacist's?
You can do both. I definitely have heard stories of people so yes, if you're in BC and you don't want to, mess around with the computer, please I do advise you just go to your pharmacy. A lot of them are very flexible. They'll just probably take you in or let you know, yes, in 20 minutes, or maybe come back in an hour. And I've definitely heard that. But in BC, it's almost kind of like it's a continuation of our COVID-19 vaccine program, where you would get an invitation to book. So it's not like you had to just, I need to register. You would be notified of when to register for your COVID vaccines. And so they continued the same program in BC when it came to the influenza vaccines. They said, and the COVID-19 fall boosters. They said, yes, these are available, but you're going to get an email to let you know when you can register. Because they kind of still wanted to follow a bit of that phased approach, where, especially with the booster doses, where certain groups were kind of, ahead of the line for very good reason to get their boosters earlier. So that's kind of what the system is in BC.
Wonderful. A question just came in. I know that there's another vaccine that people are interested in hearing about, is the shingles vaccine. Is that also available in British Columbia, but not paid for by the province?
Yes, that's right. There are a few that are available, and for age, I believe, 50 and up, and that you can pay out of pocket for them. And I do apologize, I didn't include that information in here because I thought I was going to run out of time.
Yeah.
But if you are in BC and you do want to know, I did find a really good website, and I will actually maybe, are my slides still up?
They are.
Okay,
but you can put that in the chat. Oh, there it is.
Okay, here we go. So this is where I did find information on those shingles vaccines in BC. And in terms of, they even included a bit of the cost of some of them. So if you go to this website, I'm happy to share this website as well, because this is the one that I use as a healthcare provider, particularly during the pandemic. It's one that's geared towards the public, but all of its information does come from groups like NACI, from the Centers for Disease Control, from public health experts. But it's kind of like in more easy to understand, direct language. And so if you go to Immunize BC, just Google Immunize BC, you'll find this page. And they do have a specific shingles page that talks about these vaccines and how much they cost and who
Great.
can get them.
I've just put that into the chat
Oh,
box so
thank
people
you.
can click on that. And that's part of CARP's advocacy more broadly, Cherlyn, that we want all Canadians to have access to the best-in-class vaccinations as part of our campaign to keep Canada healthy. Oftentimes, older adults, seniors will be of the sense that if the province isn't paying for a vaccination or some course of therapy, that it's something that's nice to have, perhaps, but not something that is vitally important to their health. And that's been our advocacy right across the country. We've made great strides in many provinces, as you've noted. If you would have shown that slide 2 years ago for the high dose flu shot for seniors, there would have only been one province that was providing it at the time, and it's coming across the country. So we hope that British Columbia will consider providing those recommended vaccines without out-of-pocket payment. And my point would be to our members that while you're getting your flu shot, if you haven't already, get it now, but be sure you're contacting your MLA or your Minister of Health and saying that this is something that we believe, or I believe as a CARP member, that the province should be paying for, and encouraging more people to be protected with the best available vaccines.
Anthony, I'm so glad you mentioned that. Can I share just a quick story?
Please.
Just based on that. So, this idea that if a vaccine is not publicly funded, so if it's not free, that maybe it's just a nice to have. This is an idea that not just the public has. I would say that healthcare professionals have this same kind of misconception. And so I'll share this story. A couple of years ago, I had a client come in, was seeing them with the nurse practitioners. So we were seeing this person as a team, and he was like, I really want this kind of this better vaccine, this high dose vaccine. I'm 65 and I want it. And so unfortunately, this individual didn't live in one of these specific areas, was not in long-term care or assisted living or a First Nations community. But in his situation, he was living in in BC, we call it supported housing. So this is housing that's often for folks who maybe previously were experiencing homelessness. And he had like lots of other chronic conditions, but he didn't fall in those categories. So he wasn't eligible for that vaccine. And, we said, we're sorry, we don't have this vaccine. So we just can't give it to you. So we ended up offering him the standard dose, but we didn't even know, we didn't even broach the, do you have, what is your budget like? Do you think that this is something you might want to pay for? Because unfortunately, it's not free, but we didn't even have a conversation because we were also under the impression that if it's not publicly funded, it's either not available or it's available, but maybe not that important to have. And so unfortunately, we are in this situation where you folks who are the patients and the clients have to be maybe really good advocates and really be more direct with your healthcare providers, because sometimes they just don't know. But we're hopefully getting the word out to healthcare providers too, and pharmacists are doing such a great job with that. And actually, I would, if you ever have any questions about vaccines around that, I would say a pharmacist is a really good person to reach out to, because for folks like myself who are really embedded in kind of public health, we're so focused on the public health funded vaccines that sometimes we don't have the other ones at the forefront.
I wanted to ask a question to you about COVID. You early in your presentation, you mentioned about the differences between COVID and the flu, and perhaps testing for COVID. But if someone does test positive, either through a home test or a test with a medical professional, a PCR test, I understand that there's a treatment that can help slow down the effects of COVID for people over age 60, and that's Paxlovid or Paxlovid. How can someone go about getting access to that medication in British Columbia?
So definitely that you would have to have a conversation with a prescriber, an NBC that's a nurse practitioner or a physician, a general practitioner. But if you are home at sick and you are in BC, there are kind of like lots of more online telehealth options so that you can have this conversation if you're curious, but you don't want to leave your home right away or you can't. Um, so I would advocate for having that conversation because some of these medications are available, but that again, just like with all medications, some can have certain side effects, and if you're already on medications, that would be important for the prescriber to know. So definitely have that conversation, especially if you are older and you're infected with COVID.
A couple of questions came in about side effects of the vaccinations, both for COVID, influenza. So what can you tell us about what those potential side effects could be if someone's hesitant to get vaccinated?
Yes. So with both of these types of vaccines, COVID and the flu, the really common one are the local reactions. So these are when we say local reactions, we mean at the site of the injection. And so you can get soreness, that really heavy arm feeling, and but it is very short. At the most, it lasts a couple of days, um, and you can get um, also some reactions where you actually are feeling unwell. And again, it's not because you've been given COVID or the flu, but it's actually because in a way, your immune system is waking up and it's working. It's responding to the antigens that have been injected in your body. So you might have some of those symptoms as well that kind of resemble a cold or feeling unwell, but again, that those will be really short and limiting, and also would be nothing compared to if you got the actual flu, which I can attest to is much, much worse.
And there's a question here about getting the flu shot, the standard dose. Could they or should they get the higher dose flu shot as well, get the other better vaccine? And I
Ah,
don't know if you have a response to that, but I can tell you what I heard in a webinar with a doctor
sure,
yesterday.
sure.
And he said, yes, go ahead. So I'm not sure if what your response would be.
So you mean that this is if you've already had the standard dose?
Yes.
Ah, I see. And then so this person said, yes, you can go ahead.
It's a
Yeah.
Dr. Grossman, who's the former chief of medicine at a hospital in Mississauga, Ontario, a respirologist. And he said, yes, if you've had the standard dose, add an additional layer of protection wouldn't hurt you if you went for the high dose as well. So that was
You know,
his response. And I'm not the doctor, but I can
I
tell
can say,
you
what,
that was his response.
I do agree with them because there you wouldn't have any, it's not going to really harm you to have kind of like this extra dose of an influenza vaccine. Per se. I mean, you might have, maybe a bit more of a local reaction, perhaps, depending on how long ago your standard dose vaccine was. I mean, most folks would say that you probably don't need to because, again, the standard dose it is a good vaccine. It is
Mhm.
very effective. It is approved for everyone. Um, so maybe not necessary. I would say maybe not as necessary, but it wouldn't be harmful if you just wanted to go ahead and
Yeah.
do it. Yeah.
And speaking of experiences in the pharmacy or the doctor's office, if someone is in the office getting a flu shot, for example, they can also get their COVID vaccine at the same time, or booster, or vice versa.
Yes, and that's what I did. So after I recovered, the vaccines were available, and I got both of them at the same time, one in the other arm. So both my arms were a bit sore, but yeah, I was happy. I felt it was worth it.
And you mentioned quite a bit about immunosenescence and the decline of our body's natural response. Uh, those who respond to our invitations to these educational webinars often say, I don't take any medications, I'm in great health, I don't need a vaccine. But they don't know what's really going on under the hood, as a mechanic
Yes.
might say. So how do we bring that group of older adults around to the fact that even though they feel great, that 20 is not the new 40, or vice
Yes,
versa.
it's true. I mean, it's so good to hear that people you know, are getting older, but also feeling so good. So that's, very hopeful for me. But I would also just again reiterate the story that I told about my mom, who is now she's in her 80s, and she doesn't take any kind of maintenance medications at all. And then when you compare it to my dad, who's even older, in his very much into his 80s, who does take daily medications, but when they both got COVID, again, my dad was not sick at all. And my mom was the one who was really hit hard. So you just don't know. Even if you feel really good, you don't know what strain you get. Right? There's different strains circulating out there in the community. You might get the one that just has, a little bit more of that edge. And then, but your friend, your neighbor, your husband doesn't get that strain. So you really don't know. And what's going on for you at a particular moment. Maybe it gets you, maybe an infection gets you at a time when you were having a really busy week, a really busy time. You haven't been sleeping well for a couple of weeks, and all of those things, they do add up. And sometimes certain situations like that can create a perfect storm where someone who is generally healthy in their everyday lives really gets hit hard by some of these illnesses.
And the flu vaccination, regardless of what dosage it is, they can't make you sick with the flu. And
You
I
don't,
know that,
yes,
and
yeah.
I know that there'll be many anecdotal stories of, well, I never had the flu until I got a flu shot, but the connection is not there.
Yes, yeah. I mean, my husband, like he got a flu shot many years ago, and then I'm feeling I don't feel good. I'm feeling run down, but it lasted a day, and so like I said, I'm in my 40s. I get the flu, and it's not even just the 5 to 7 days that they say. It was 21 days. So if you feel a little unwell for a day or two after getting a vaccine, it's still much better than being out for 3 weeks of your life. I know, no, everyone's busy. Nobody can be out for 3 weeks of their lives. So yeah, it's not the actual flu. It's really just your body's just kind of like, oh, time to get to work. So that when it does come into contact with the flu or COVID in real life, it really can respond.
I'm a follower of the Health Canada Flu Watch system, and every week I get an email from Health Canada asking me if I've had the flu or if I've felt any fever or illness. And it's a reporting mechanism that Health Canada uses to gather uh, uh, feedback from Canadians, and as well as they measure the positive tested cases across the country. And right now, if we look at British Columbia, we can see that there is considered widespread outbreaks in lower BC. And I just wanted to share this information that came into me this afternoon with everyone watching today, and just to highlight how important it is to protect yourself. Going into the holiday season, we'll all be indoors, hopefully hugging and kissing our family members, and that's where the virus can spread and strike. So, and we can see through this graph that it is active in British Columbia right now compared to the rest of the country particularly. So no better time than the present to go out and protect yourself. So I'll stop sharing that. And are we back to us again? Stop sharing. There we go. So we're back, and we've hit the top of the hour. So I wanted to thank you very much, Cherlyn, for your wonderful presentation. It was tremendously informative. It will be saved on our carp.ca channel and shared with everyone who registered. And hopefully we'll have hundreds of more BC residents sharing and watching this video and protecting themselves during this important holiday season. Thank you very much for joining us again.
Thank you, Anthony. Thank you, everyone, for your time. Stay safe. Happy holidays.
You too.